Hello, everybody. Hope you're doing well. This is Dan Hewson, and I am here today with you for another episode of Coffee and Audiology. And as always, we want to make sure that you have your coffee with you. Today, I have my cup from Nebraska. This is from Starbucks, and it's always kind of fun. One of my little favorite things to do, no matter where I go, I like to be able to get a cup from wherever city I'm at. So today I'm visiting Nebraska. My wife's mother-in-law lives there, as well as her grandmother. So it's pretty cool. I should say it's not my wife's mother-in-law, it's my mother-in-law. You have to let me know where your cups are from as far as where you've gotten some of these, if you have them as well. So today's a Nebraska day. And as I say, coffee is such an important thing because it actually gets me motivated. It gets my brain working better. And that's going to be the focus today, is to talk about more about the brain and more about the ears and more about anything going on with your tinnitus, with questions in regards to your dizziness, balance issues, hearing loss, hearing aids, anything that you have issues with. I just encourage you to please send me questions, and I will answer your questions directly in these talks. For those individuals that just don't know, they want a second opinion, they're concerned about the decision making that they have about their hearing loss, any of the issues that we talk about, please feel free to message me and direct questions towards our show so that I can present them. Just as a background, I've been practicing for 25 years and I've worn hearing aids for 43 years. So it's, I have a 75 to 80% loss of hearing, and that's a lot. So I really only have about 20 to 25% to work with. When I take those hearing aids out, I don't really hear anything. So let's get right to our first question of the day. Which hearing aids is best? As I am deciding between a custom hearing aid and a behind the ear hearing aid. When you're looking at hearing aids, it doesn't necessarily matter per se, because at the end of the day, we can still help the hearing loss based upon something in the ear or behind the ear. There's a lot of different aspects about them. But number one can be, and a custom hearing aid is in the ear. It's made very specifically where we take an impression of the ears, just like we do if you had teeth done, like a dental appointment where they take an impression of the teeth. Same thing with the ears. We do the same thing. We take an impression of the ears. So custom hearing aids are wonderful because they fit in down inside. They're custom made to the ears. And people love that. And a lot of people who are very conscientious of wearing, I don't want anybody to see I have a hearing aid on, because they just can't bear the thought of people looking at them like it's a disability, if you will. Well, I've worn hearing aids, for so many years. Mine are the in-the-ear ones that fit inside. And, I've worn behind-the-ear hearing aids too. So I always tell patients, let's talk about both options. And I cannot tell you how many people are never discussed about which options they should go with. They're just told you need to go with behind the hearing aid, it's the best hearing aid for you. And then down the road, the patient says, well, my friend Billy got one in there and loves it. How come you didn't tell me about that? So it's important to know that this question's a great question, because why would I pick one or the other? Well, if you have a custom hearing aid, let's talk about that first. An in-the-ear hearing aid that goes down inside, it is obviously the most, hidden device, especially if we get something called a CIC or an IIC. So CIC stands for completely in the canal, and an IIC is an invisible in the canal. Now, there are concerns medically that can prevent us from wearing these types of devices, such as a history of ear infections, history of perforations, things like that, having that in there where your ear shouldn't be plugged inside of that, or even a history of wax inside of your ears. We really need to kind of verify if that kind of hearing aid is best for you, because maybe we need to get something that's either further out in the canal or maybe going back to behind the ear hearing aid. But the number one reason why people wear a custom hearing aid is because of the fact that they want something hidden or smaller. Or in today's world, because of wearing masks, we have to be very aware of, behind ear devices do sit behind the ear. And so that's become a big thing since COVID has started, that we have a lot of patients who have lost their hearing aids because when they took the mask off, it caused the hearing aids to come off. So let's take a quick COVID moment here and talk about masks. So when you're wearing a mask, if you have a mask like I do that goes right behind your ears, I would recommend pulling it from the bottom and then lifting up and over the ear and make sure that the hearing aids are there. And a quick recommendation is when you do take the mask off, make sure you either do it in your car or you do it at home and not somewhere you're not your normal environments. Just in case if you do lose it or it does come off, it's at least somewhere that you're more familiar with, home and in your car. So going back to the custom hearing aids versus the devices that go behind the ear, it's really important that the custom devices have one disadvantage with them is having wax that builds up inside of the hearing aid. So if you have a big history of wax in the ears, you're going to have a lot more challenges with a custom hearing aid that can build up with wax in there. So it might be recommended to think quite a bit about that first of all, because you may have a lot of chronic problems with the hearing aid, and you may want to blame the hearing aid in that regard. It's not the hearing aid's fault at all. The custom hearing aid is a wonderful device, but sometimes, depending upon the type of hearing loss you have, especially if you have good low frequency hearing and you have worse high frequency hearing, sometimes we take that little hearing aid and we put that hearing aid down inside of their ear. So this is mine. You take this hearing aid and you put that down inside of the ear. Putting that down in there, the person may feel like, oh, my ear feels full. It feels stuffed up. It feels like I'm talking in a barrel. Well, there's a reason for it, and it's called the occlusion effect. And so sometimes we have to really be cautious for the provider's sake to make sure we make that just right for the hearing loss that you have. So sometimes, depending upon the hearing loss, the patient can never get past that feeling of occlusion in there. Now, I've worn custom hearing aids almost as long as I've worn behind their hearing aids. And I will say I wear custom hearing aids for as long as I possibly can. And, for the sake of today, I won't get into all the details, but at some point we will discuss that. But the custom hearing aid is really wonderful because there's nothing behind the ear, and the fact that it does go down inside. As a whole, the lifespan of the hearing aid of a custom instrument is not as long as the one behind the ear. So keep that in mind, that for those individuals that wear hearing aids that go behind the ear, the lifespan of the device is a lot longer because the most important components are behind the ear with the speaker that does go inside of the ear. But generally, most manufacturers, we can replace the receivers, even when it goes out of warranty, and the hearing aid can still work. So keep that in mind, that when you're looking at, the insertion of something, when you have a hearing aid like mine that goes down inside, it's subjected to a lot more oil, moisture, wax, and things like that. So be very well aware of that. But when you look at a hearing loss behind the ear versus in the ear, when you look at the hearing loss part of it, we can fit that across the board for just about every hearing loss. The behind the ear device, why they become so popular over the years, is because of the fact they got the little tiny tip on the ear. You can place that down inside and it feels very comfortable. You don't even realize that something's in the ear, and it feels like it's just nothing. And that's what people want, is a feeling of nothing. Like they know that it's there, but it's not bothering them. They're not thinking about it. But it's important to make sure that the practicality of the device is right on target, because you need to make sure at the end of the day, whether you have something in the ear or behind the ear, that the hearing aid is fixing the problem of the hearing loss, that what you came in for, what that loss needs to be very focused on the issues that the patient has. So what I recommend for a custom hearing aid or behind the ear is really making sure you work with your provider to really understand, first of all, you need to be explained what a custom hearing aid can do for you and a behind the ear hearing aid can do for you. Now, it needs to be in relationship to your hearing loss. So again, if you have questions about that, you can always send me a copy of your audiogram, and I'd be happy to look at the loss and we can discuss about the type of hearing loss that you have in relationship to that. But the point ends up being is that, some people I've tried, they don't know. They flat out don't know. And I'll start a trial period with them with one device. I usually start with the one they really want and discuss with them, hey, I want you to be aware of that if for some reason during your trial period, you decide you want to go back to the other hearing aid, we can definitely do that. But I want to make sure we do that before the trial period's over. Because at the end of the day, at least for our practice, I can tell you, we want to make sure you love what you wear every single day. Now, one other thing about a custom hearing aid versus behind the ear, a custom hearing aid going way down inside sometimes doesn't connect to your phone. So if you want to stream, sometimes it will not stream. Whereas behind your devices, most of them do. So it's really important, like I said, it's very individualistic, but it's very important to go through the medical aspects of the hearing loss as well as the hearing loss part of it as well. Hope that answered that question. But if you have something more specifically, again, ask me those questions and I'll be happy to answer them for you. Direct message me, send me your information, and I'd be more than happy to contact you. Okay, question number 2. So I'm gonna take a quick sip of coffee again. Question number 2. I have diabetes, high blood pressure, and chronic kidney disease as well as neuropathy. Is it possible that any of these are the cause of my hearing loss? That's a lot, okay? And so there's some correlations, obviously, in blood-related situations when you have, diabetes and when you have high blood pressure, chronic kidney disease, when you're looking at neuropathy. When somebody has chronic kidney disease, a lot of it has to do with toxins in the body. And some people, the medications they take are ototoxic. And so ototoxic medications is medications that are just terrible for the health of the inner ear and can cause further hearing loss, can cause tinnitus, ringing in the ears. It's just terrible. And now, I'm not saying you should take the medication, okay? But what I'm saying is it's important to be aware of that when we do have issues with chronic kidney disease, that yes, 54% of the individuals that have chronic kidney disease also have hearing loss. So it's very important to know that there is a correlation between the two in regards to that, but it's important to, go through the case history to determine what is that correlation between the two. Just like if you have high blood pressure, it needs to be controlled. It can cause many, many other issues, but having high blood pressure can definitely have an impact on, obviously, the blood flow that works inside of the inner ear, just like it does in every part of our body. It can affect our vision, it can affect our ears. You hear about that with many things, but hearing it does affect that as well. And even those that have diabetes, unfortunately, there's a definitive chance in that regards that is correlating with hearing loss. Those individuals that have diabetes, the simple facts of diabetes is simply the fact that individuals that have hearing loss and diabetes, they're go hand in hand. We ask questions very simply all the time. You have hearing loss, you have high blood pressure, you have diabetes. And so it's very important to be aware of that factor so that we know exactly what's going on. So people that are diabetic are 2 times as likely to have problems with their hearing. So it's really, really important to understand that when we go through case histories, that we understand what you're going through. A lot of times I've seen patients who will come into our office and we sit down and we talk about their case history, and they go, I've been in places before where they never talked about my case history at all. They just go and let's go to the hearing test, let's go right through it, let's get the hearing aids on you. And I can't tell you that when you're looking at a patient, you have to look at all the factors. You can't just test their hearing. There's just too many things. Again, I always say this, hearing loss is not one-dimensional. We need to take the time to figure out why you're here. How did you get here? And I always tell patients that, it's important to look at 3 things with hearing loss. Basically, where did this originate from? What kind of things occurred in your case history? What kind of noises have you been around, hereditary nature, medical relations, anything that's caused this hearing loss? And now we have to focus on where we are. Where are we at with the hearing loss that you do have? And number 3, we need to focus on where are we going with this? And so it's a roadmap of the journey of where you've been, where you are, and where you're going. And that's why I always look at these types of things, that no matter what kind of issues that a patient has when they come in with this, and the fact that there is a correlation, even with neuropathy, obviously it's nerve related, different things that can occur with our body in regards to all of these factors, that we need to verify with each patient that these issues could also, some of them can cause the tinnitus, the ototoxicity, cause balance issues, hearing loss, and eventually can cause problems with the person's cognition, their mental acuity, because of the fact that they may have had the type of hearing loss that can lead down the road of causing brain fatigue and brain fog. So it is important, it's imperative that people in general, the public as a whole, we as people look at hearing loss and go, we just turn the volume up and makes it louder. But how many of you out there have watched, give as an example, how many of you watch TV out there, turn up that volume, and guess what happens? It's louder, but it's not clear. Or when people that are frustrated with you, they talk louder, and you go, why are you talking so loud? Because you're not understanding me, they say. And that's why I always tell you that the information is so critical to have the providers and just the ones that are taking care of you to really look at you for the full factors of the hearing loss. How did you get here? What caused the issues that you're having? What kind of medical issues are you having that could be causing these problems? It's almost like us being like a detective, being able to determine what was wrong, what causes hearing loss, what causes dizziness, what causes tinnitus, what causes memory concerns, what's caused all of these factors, what got you here. Because at the end of the day, when we look at somebody, this individual that has had the diabetes and high blood pressure and chronic kidney disease and neuropathy, it's important, no matter what the conditions are, we need to know what could have caused these problems and figure out how we can make it better. And so at the end of the day, having all of this could have caused a hearing loss. And the answer is yes, it could have. Now, there's a lot more questions to ask besides those four things, those four medical conditions. We need to know more about your case history. We need to know about your family, your familia side. We need to know more about your industrial noise-related side. We need to look at a lot of factors and medically that have gone on with your ears as a child, as an adult. Just so many different things that need to be aware of so that we can help you as an individual. That's why it's important. When we're doing these types of shows, the focus is to educate you, and always remember to ask the questions. If there's something you're not sure about, something doesn't feel right, my grandmother always used to say, when in doubt, don't. If you have any doubt about doing something, then don't do it. Ask questions, educate yourself, learn more about what is going on, because in my 25 years of practicing, I've seen too many people get, just not taken care of. I don't want to say taken disadvantage of or taken advantage of, but they just were taken care of like they should have. And that is the purpose of the show, is to help you recognize, hey, what's going on? What do I need to do to get taken care of properly? So that's why, in this case, could this have caused a hearing loss? Absolutely. So let's go to number 3. Question number 3. I recently went shooting and my left ear is not hearing as well. Is there any prescription or exercises I need to do to get this back? I have not done anything about it up to this point. So for our shooters of the world, or people that work in very loud situations, noise damage is one of the greatest reasons why we have hearing loss. And it is very important to tell you that all it takes is one sound source that's loud enough to do immediate and permanent damage to our hearing. So when we have this kind of an incident, like this happened to you, unfortunately in that left ear, there a lot of times, think back to those of you that have gone to rock concerts or concerts. You have the big speakers that go, to the ceiling, it seems like, and you left that concert, it was 2.5, 3 hours long, you left the concert and your head was just bouncing, right? And you went and it got out of you were ringing ears and you had hearing loss, and it got better after a few days. Now, if we could have done a hearing test before, and then right after the concert, and then we do a hearing test 6 months later, and then kind of look at it, you would see an immediate hearing loss. Now, what they call it is a temporary threshold shift. And so that's why when we do a hearing evaluation on somebody who comes in with this situation, there's not a lot that we can do. We do a hearing test, and if we do see a shift in the hearing, then we will talk to the individual, about trying to protect their ears from loud noise exposure, discuss with them why it's bad to be around noises like that. But the key is now we have to wait a little while to be able to see if that hearing doesn't restore. You see this a lot while we do industrial testing. We can't do industrial testing on individuals while they're working without giving them a little leeway of time to let their ears rest. Because if they're around loud noises and do a hearing test, it's going to be contradicting some of the results of what we're trying to achieve. So when we have somebody such as this individual who, when shooting and now can't hear out the left ear, there's no exercises or prescriptions that you can really give somebody to be able to bring that hearing back. Because what happens is when sound goes in that fast, we have a little mechanism inside of our ear that's designed to try to protect our inner ear from noise damage. But when something is so loud and occurs so fast, it goes through and does its damage without it being protected or blocked because it's too loud. And so it's important to understand for the shooters of the world that don't wear ear protection, or I'm just going to shoot once, or if we work in industrial settings and we don't really wear our protections all the way in our ears, we kind of leave it out so we can hear what's going on. You have to understand the true implications of the hearing loss, that it really destroys a lot of our mid to upper high frequencies in regards to our hearing, and can cause tinnitus, ringing in the ears, and cause a lot of problems later on with comprehension as well, of understanding the clarity of speech and language. So in the event that this individual needs to be monitored and tested specifically in regards to their hearing loss, I have seen some doctors put patients on prednisone, different things like that. I am not in the position to tell you what you should or shouldn't take in that regards from an ear, nose, and throat standpoint, but I will tell you that basically a lot of times what it is monitoring. bring the patient back. Let's bring them back in 6 weeks and see where they are. Because at some point, and I've seen this many times, you see this in those that are truck drivers. And for those of you out there that are truck drivers, beware, because when you're driving and that window's open, and you're doing this for years and years and years, we know a truck driver because their left ear is down. So be aware of that factor as you're driving down the truck. It's great to feel the air and hear the sounds, but unfortunately, it's a lot of noise damage driving 65, 70, whatever miles an hour. It's going to cause a lot of problems. Same with shooters. You can always tell, I shot my gun, boom, boom. Well, we always know the shooters because we'll say, are you right or left-handed? Well, they say, well, I'm right-handed. Okay, well, we know the left ear was affected because when they shot the gun, the barrel was on the left side. So you got more damage done in the left ear, vice versa with the other way. So it's important to really kind of take the time, as we say, about doing case history, to really verify, well, what got you here? Well, what was the real root of the problem that occurred? Now we shot the gun, it occurred, we do a hearing test, see where we are in the future of this. Is if your hearing loss continues to stay the same, that individual may need to get a hearing aid for that ear. So, and properly instruct them and allow them to know that. So for those of you that this has not happened to, please take care of the hearing. You can get inserts, you can get ear protection, you can get muffs that you can wear. There's so many things that you can do to take care of this issue, but you just got to be aware of that. And so a lot of people, even though they know they should wear ear protection, you know, if you're running saws and you're running loud equipment, heavy machinery, construction workers, you know, factory workers, unfortunately, these things can cause a tremendous amount of noise. Even landscapers, you know, their lawnmowers and equipment that they use, chainsaws, things like that, tremendous amount of damage that it can occur. And again, we get ringing in the ears, tinnitus, you see that from patients all the time. And again, it's from noise damage. So just taking the awareness and the education of taking yourself, getting it tested. When you have a situation like this, shooters, you know, anybody sudden hearing loss, something sudden like that, always should go in and get tested immediately. And I always recommend an audiologist first, because they're going to be able to give you a lot more understanding, even if it's sudden hearing loss. We've talked about sudden hearing loss before in the previous show, but the point is this is the same thing. Sudden hearing loss occurs. Shooting a gun, getting it tested. Let's verify where things are and let's find out what's happened and where we're going from here. So I hope that helps you, but proper protection and education of what's happening to those ears are extremely critical. You know, our hearing is so precious, and you don't understand that when we're younger. I can tell you that I see this every day, that individuals that get older, they get frustrated and irritated and agitated. And when you shoot a gun and you don't use protection, all it takes is one time. So make sure you and all of your friends and anybody that you work with that are always wearing ear protection. Out here in the desert, they do a lot of shooting out in the desert, and because it's a perfect place way out in the desert and go shoot and so forth. And the key is a lot of times people are just having fun and they forget and they didn't bring their ear protection on and they shoot at one time. So we do see a lot of that here in Arizona where we see patients having that issue. So please take the time to really look at these factors very much so that you can prevent yourself from having more issues with the hearing. So thank you so much for joining me today in our episode of Coffee and Audiology. And I appreciate you and your time of listening to me, allowing me to educate you, help you learn more things about what's going on in your world. And please let me know what is going on in your world. What's happening to your situations? I want to know, and I want to help you as much as I can with the way that you're hearing, the way that your brain is working, the way that the dizziness or balance issues and tinnitus, all of the factors that you're frustrated about. Please reach out to me, direct message, let us know what's going on so that I can help you in whatever way that I can. And until then, have a wonderful day and thank you for joining us. We'll talk to you soon. Have a great day. Bye now.